have Dr. Danenberg here, and we want to, well, I would love to, if you could share his story of healing, his story of, he's recently diagnosed with multiple myeloma, but that's not definitely what defines him. He's written this wonderful book, which I've been carrying around with me the last couple of weeks. It's a wonderful book. His accomplishments are many. He's not only a dentist, he's a gum specialist, he's a functional medicine doctor. He's actually, he'll have to correct me if I'm wrong, but I believe he's got his MBA, or definitely he's got some work in the financial sector, and so I'm just really in awe of him, and I'm so excited. But most importantly, I got to know him by his work in dentistry and kind of exposing, maybe exposing is the bad word, but just kind of showing the reality of how we should care for our mouth and what things are toxic and what things are non-toxic. So we have a lot of things to talk about. So I hope that you guys, I asked you to bring questions, but we can keep him on forever, but we're not going to do that to him. So I'm going to invite him on right now because I don't want to wait. Hopefully everything's working. There he is, doctor. How are you?
I'm great.
You look well.
I hope you're doing better too.
I am feeling 100% better. I still don't have the strength in my legs quite yet, but I'm getting there. So
good. Good.
But just the feeling, I went in for a colonoscopy, and it just, I don't know, the medications and everything, they really just depleted me of every mineral of any. And so by the time I was done, I don't know if you saw a video, but my son actually had to carry me up the stairs.
I did see that.
Did you? I saw that video, and it brought tears to my eyes because it looked like a spinal injury patient. My head was flopping, and I thought to myself, I'm never going to recover.
So the first question I would have is, why a colonoscopy? Okay. But I don't want to even go into that.
Okay. It was a long story of constipation, which, you know what? I trashed all the medication again, and that's what I did with multiple sclerosis. I'm going to make this real quick. And I went to eating fiber and eating the Wahls protocol and doing everything I was supposed to be doing. And lo and behold, I'm having bowel movements and everything, and hydrating and taking magnesium, and everything's back to normal. So I just felt like I should never have did the colonoscopy. I should never tried the medication. That's a whole different story. But
I'm totally in agreement with you, because that is obviously how I'm treating this terminal cancer that I have. Certainly not conventionally.
Can you expand on that? Because a lot of folks know you.
Sure.
A lot don't. And so I'm going to let you tell, because
Sure.
A lot.
So just to give you an idea of what eventually happened to me, first of all, I'm 71 years old. This past April, up until this past April, I would have told you I was the healthiest 71-year-old walking this earth, because I was. I mean, I exercised, I slept well, I ate amazingly healthy diet, basically like a Wahls protocol diet, and I was walking through the Atlanta airport. I was doing a meeting, actually, at Paleo FX in Austin. I was a speaker there. I was coming back, and I was carrying my bags. And whenever I go to airports, I try to walk rather than take the train. In the Atlanta airport, if you know, there's several concourses. If I have the time, I walk rather than take the train. So I was walking with a heavy bag on my right shoulder, and by the end of that little walk and sitting on the plane coming home, my shoulder started to feel really sore. So I figured I tore a ligament or a rotator cuff, or I just did some temporary damage. Well, generally, if I hurt myself, it heals within a week to 10 days, and it wasn't healing. And as a matter of fact, the pain started to go into my back and then moved towards my chest, my rib cage, and it just felt really uncomfortable. So in sometime early September, maybe end of August, I went to my general physician, and I told him, and I've seen him for 35 plus years. So I said, what do you think's going on? I'm sore. And he's looking at me, and he tells me, obviously, I'm sore. Let's do some blood work. And he takes several conservative type blood tests, and one of which was the C-reactive protein. So everything is coming back normal, except the C-reactive protein. I normally run a little less than 0.5, which is very, very healthy. And this was like 3.5, 4.0. And C-reactive protein is just a biomarker of systemic inflammation. It doesn't say where the inflammation is or what the problem is, that it's just systemic inflammation. So he said, let's do an MRI. So we do an MRI, and after the results, he calls me and says, I have the results. Do you want to come to the office to discuss it or go over it on phone? And I said, well, let's talk about it. So he said, if I were you, I'd be very concerned. And he says that I think one of three things is going on. You either have lymphoma, leukemia, or multiple myeloma, none of which are an exciting diagnosis, right? And I mean, it's not like you have a cold and it's going to get better. And there's a mass on the side of my spine, a soft tissue mass, and he sees several ribs that are cracked, a broken vertebra, and a cracked pelvis, and he says, did you fall down, or did you get in a fight? I'm a wuss, so I don't get in fights, right? So
you had all broken bones, and you were only had some discomfort in the airport.
Right. Wow. So he gets an oncologist involved. We do a CT scan and a soft tissue biopsy and a host of other very specific blood tests, and it turns out that I have an aggressive form of multiple myeloma. And on September 19th last year, he makes the diagnosis.
Wow. So and the CT or on the X-ray, is it moth eating? Does it look like you have like Swiss cheese?
Yeah. So the radiologist that read the skeletal report couldn't even count the number of lytic lesions, so it was termed innumerable lytic lesions throughout the entire spine.
Is your blood calcium like through the roof?
You would think, right? So the blood calcium is slightly high normal, but nothing out of the ordinary. For the most part,
it's going to affect your heart, right?
Well, yeah, and a variety of other things, just cognitive issues, and then he says more than likely your healthy diet and lifestyle prevented the manifestation of this disease until now. Wow. And this is September 19th, and he said, based on what I see, I give you 3 to 6 months to live.
Oh boy!
So that's a prognosis that is hard to swallow, right? Mm-hmm. So then he gives me options. I can start doing chemotherapy right away, IV intravenous bisphosphonates, which you know are terrible, maybe stem cell therapy later on. But he says, unfortunately, this is not a curable disease. No matter what we do, it's not curable, and as the submission of the malignant plasma cells is getting under control, then it will get out of control, and they would have to change the chemotherapy to a more aggressive form. Eventually, I would succumb to the manifestation of the other diseases that this particular malignant plasma cells would create, like infection or an incurable infection or anemia, internal bleeding, some things that that would happen no matter what. So I'm saying to myself, I'm not going to damage the quality of life that I have with all these chemicals and then still die. So I elect only one thing, and that was radiation treatment of my sternum, which is where the most severe pain was. 10 days of that took care of the problem, but it doesn't treat the disease. And then I've gone on to a host of other what you would consider unconventional or alternative type of therapy. I take up to 30 different supplements 5 times a day. I'm doing a variety of things to improve my gut microbiome. I take medicinal cannabinoids, and what I believe is really significant is I use pulse electromagnetic field therapy using a full mat for my body 4 times a day. And there is some great research that suggests that cancer is a mitochondrial metabolic disease, not a disease, not a genetic disease. And if you can address the mitochondria that are dysfunctional and figure out the metabolism that's there or not there, then you may be able to get this under control. And that's what I'm trying to do. Now, obviously, it's more than 3 months. I feel great. My only issue is that I get tired. The discomfort that I have is easily taken care of with over-the-counter Advil, which is fine.
Wow.
And I'm good to go until I'm not. So I'm okay right now.
But it's past 3 months, and I understand you have a blood test coming up that's going to...
Right. So in 10 days, we have decided, my oncologist, my conventional oncologist, decided that we don't need to take blood work every month. This time it's every 2 months because basically the last time was relatively stable. So I have new blood work in 10 days, and we'll see where we are.
Well, fill me in a little bit. What is this blood work going to tell you? Are you going to look at T-rex?
So it's very specific for the antibody, the malignant plasma cells and the monoclonal antibodies that they are producing that are ineffective. So my antibody production is an IgA kappa light chain, which is the form of this multiple myeloma that I have.
And so that marker, that's going to tell, okay.
That's going to tell me the ratio. The ratio of kappa to lambda, I mean, it's kind of difficult, but the ratio should be 1-to-1, and it's like 1,500 to 1 right now.
You feel great. You sound like you look great.
I feel good. The only thing that I feel is a little fatigue. Not at this point, it's like 12:30. I don't have much fatigue now, but I'm great in the morning. I'm great most of the day. By 2 o'clock, I get tired and need to take a nap. And by 8 or 8:30, I'm really ready to go to bed.
So am I. Right. I mean, with the 5 kids. But do you use anything to manage?
You have 5 kids. Wow.
Yeah, we have 5 kids.
Cool.
They're all wonderful. And my wife is she's the angel. She's
I know. I have the same situation. My wife is my pillar.
I used to be the rock. Now she's the rock. So
I totally get it.
Yeah. So do you do anything to manage fatigue? Do you do anything like nootropics, caffeine? I don't know, like what?
No, I mean, I walk as much as I can, but nothing like I used to walk. I used to walk maybe 4 to 5 miles a day. I don't do that. I just walk a little bit. I used to do a lot of exercise, which I do not do anymore at this point because it's just uncomfortable. And literally, I'm kind of fragile. So to give you an example, I went to Earth Fare, a local healthy food store here in Charleston, and I was I was shopping on my own, and I was bending over the cart, the buggy cart, taking some stuff out to put on the conveyor belt, when they check you out, and I pressed on my side rib, and I heard a crunch, and I didn't break a rib, but I must have done some damage to the rib.
Okay.
Hearing the crunch, and then for 2 to 3 weeks after that, I was in pretty severe pain in that area.
So everybody that doesn't know what multiple myeloma, if you were to take a look at his X-rays, it would look like his bones. And hopefully they're not continuing, but it would look like Swiss cheese.
Yeah. I mean, I saw the CT scan, and it looks like Swiss cheese. Just a lot of holes. And because these malignant plasma cells are creating what they're creating, there is a IL-6, I think, interleukin-6, that is a cytokine that is actually very inflammatory, and it's destroying the bone structure.
Okay, so the problem he has, folks, if he were to fall, or if he were to suffer any form of trauma, God only knows, right?
Right. I got to be pretty careful.
I know there's questions coming, guys.
So I have to protect myself from my wife swinging at me.
That's not true.
Not true. Not true.
Not true.
And this is what I'm doing. And so I've eliminated all conventional treatment, and I feel really, really good. So I'm going to continue with this process and doing the things that I do. I think certainly the supplements that I'm taking from an integrative physician is really important. But also, in addition to that, my other research has shown me that I need to really restore my gut, and I'm doing that with a variety of spore-based probiotics and intestinal mucosal support. And the pulse electromagnetic field therapy really helps to improve the function of dysfunctional mitochondria. And I know that to be true because I did some studies about that. Actually, I did a 4-month continuous study on my wife and showed that if you just took certain spore-based probiotics, the actual mitochondria would improve using a very non-invasive test to determine mitochondrial health using the pulse electromagnetic field therapy.
That's very fascinating because it's well known that folks with multiple sclerosis like myself, our biome is different than a healthy individual, and it's mitochondrial, and we know it's mitochondrial based.
Absolutely.
And so
absolutely,
you turned me on to Megaspore. I have been working with that company, and I've been using that product quite often.
Have you noticed benefit personally?
I do now once I stopped all the GI meds.
Right. I mean, you're really going to get such a damaging inflammatory response from a lot of conventional prescription medications that they really need to be avoided if possible.
Yeah, well, they had me on different antibiotics and different
Of course, you're killing everything when you use those antibiotics.
Killing everything.
Right.
I loaded up and I use their products. Actually, so much so that I invited them to come on. So this up in March, they're very busy. But I invited the founder to come on and
Tom Bain?
Yeah, and he knows you.
He knows me and Kiran Krishnan, who's the chief medical officer.
Oh, excellent. So I just want him to get on and explain because it's a totally new concept to me. You know, I thought the probiotics I bought at like Walmart or whatever but this is a total.
I know. And even my original research suggested that regular probiotics and fermented foods that had live cultures were actually repopulating the gut, and they really don't do that. They do provide very healthy metabolites that get into the gut that are very important for the commensal bacteria in the gut and the mucosal lining of the gut.
All right.
However, all these wonderful bacteria, for the most part, are totally destroyed in the stomach acid and bile acid in the duodenum. And it makes sense because and that's a protective measure of our body. If we were not having a protective shield, we would eat and breathe so many microbes that would get into and literally damage our bodies. Now our bodies are actually on guard, and this acidic stomach acid destroys most living structures, which is which are bacteria, the probiotics. But the unique part of spore-based probiotics is that spores, and they're not soil organisms because they're not living in soil, they're actually dormant in soil. So these spores are encapsulated. They're left by animals that feed and then defecate, and these spores are in the fertile organic soil. They get on our vegetables and fruits, and if we're eating healthy organic fruits and vegetables where these spores are, we're actually ingesting them. The spores don't get damaged by the acid in the stomach or the bile acids. They actually start to germinate in the small and large intestine. And now they're not only providing beneficial metabolites to the commensal bacteria, they're actually growing themselves and increasing the quality and quantity of the remaining bacteria. So we want a really diverse microbiome in our guts, and that's what it's starting to help. So spore-based probiotics are getting now a lot of research. I think that they are the way to go. There are a few companies that provide them, but Microbiome, I think, is really, Microbiome Labs is really on the cutting edge. Yeah, so that's one of their products, but they make a product called Mega Mucosa, which is a product that is really helping the mucosal layer, and a few others that they've just launched. I love their research program.
Okay, so let me ask you a question, because this is a question I just discussed with another. I'm studying, through the Institute of Functional Medicine, so I talked to another student. We were talking about this. Right? Is it possible for you or for us, MS, or if you have lupus or you have rheumatoid arthritis, is it possible to permanently change our biome to a healthier biome?
I would say yes, because what you have, and lupus and periodontal disease and so many and probably all chronic diseases are actually a manifestation of a dysbiotic environment in the gut. So it's the microbiome in the gut that's dysbiotic. It's the mucosal layer that is susceptible. It's the intestinal lining that's breaking down, and it's not just the bacteria from foods that are helping it or not helping it, but it's the chemicals that are on the food. It's the dirty electromagnetic fields that we're dealing with. Like, I'm using my cell phone, not a good thing. But one of the side points of pulsed electromagnetic field therapy is that, and it has been shown that pulsed electromagnetic field therapy negates the damage of the dirty electromagnetic fields from, let's say, a cell phone. So if you're using pulse electromagnetic field therapy on a daily basis, then you can really repair the damage that all this dirty electromagnetic fields are doing, as well as strengthen the mitochondria.
So do you shut your Wi-Fi off at night? You shut your phone off at night?
No. I am too practical. I cannot live in a vacuum. And even if I did that in my house, going to offices, going outside, flying in an airplane, come on, this is where we live.
Everything's,
this is where we live. But if I can do something that is offsetting the damage and strengthening my mitochondria so that maybe it's more impervious to the damage, that makes sense. And this mat is like a yoga mat. It's soft, it's thin, it goes under my bed cover. I don't even know it's there. When it's turned on, you don't hear a buzz, you don't feel any heat, there's no fragrance or odor that's coming. You just don't even know it's on, other than a little light that says it's on.
So what is this doing then? Is there a simple way to...
Yeah, so it is a very low frequency, large wavelength with no voltage spike type of generating harmonic waves, typical to the Earth's magnetic field. And what it does...
Like grounding?
Probably like grounding, but it's not going to be generated throughout your body. So the mat generates throughout your body. And what it tends to do is that it repairs the different protein complexes that are in the mitochondria that create ATP, protein complex 1, 2, 3, and 4, and also improves and repairs the calcium channeling of calcium from outside to inside of the cell and back and forth. One of the big problems is calcium channels get damaged, and more calcium gets intracellular, and it is damaging the cell, creating free oxygen species, reactive oxygen species, creating a variety and a host of different problems. So it's starting to help repair. Now, that's not the only thing you need to do to treat disease. You need to really get to the source of the disease. But this is going to help repair the mitochondria. I'm thinking, the little bit of research that I've done is that multiple myeloma is not curable, and there's no known cause for it other than one thing, and it has been shown that ionizing radiation will cause multiple myeloma. Now, when I was in dental school, way back, since I've been out of school for 45 plus years, When we were in the clinics, we had x-ray machines everywhere. And I don't have any idea how well it was controlled. I don't have any idea how well I was protected. I never thought about it. So I was probably exposed to 4 years of dental school, 2 years of graduate periodontal school, having this intense radiation that's just all around me. In addition, in those days, we placed mercury fillings in teeth. And sadly enough, dental schools are still teaching it.
And
Mix
them by hand.
Exactly. So we mixed it by hand. We played with them. We had little what's called squeeze cloths, little thin cotton pieces of cloth where you squeeze the excess mercury out of the amalgam and flicked it on the floor. So this mercury vapor is everywhere in the dental clinic, all the time. So I'm sure I was heavily exposed to mercury as well as radiation in dental school. It only takes one malignant plasma cell to create what I have, because a malignant cell is defined as a cell that won't die. It's not functioning and it won't die. The reason a cell dies is because the mitochondria in the cell senses the problem and it sends out literally bullets to kill the cell. So when the mitochondria are damaged and the cell is not functioning, the cell continues to grow and multiply non-functionally and will die. And this is what the malignant plasma cells are doing in my body.
The normal cell would have programmed cell death, no?
Correct. Yeah. So normal cells die. They use themselves up. The mitochondria tells it it's time to go. It kills the cell. The nutrients within the cell that are usable are reabsorbed by the body. What is not usable is detoxified through the kidneys and liver and excreted out of the body. So the body knows how it needs to do what it's doing until the mechanism isn't working anymore.
So, all right, everybody's talking about the ketogenic diet and being certain cancers react to that lack of glucose. Is there any value in that?
Yeah, so this is part of the mitochondrial metabolic theory of this disease of cancer. So glucose certainly feeds cancer because the ATP that's created in cancer cells is from a fermentation process rather than the general creation of ATP through complex 1, 2, 3, and 4. So what's happening, as I understand it, and I'm not a scientist, but as I understand it, glucose is the best food for cancer cells, so you don't want glucose. Examples of how it is identified is there's a test called a PET scan where radioactive glucose is fed into your bloodstream, and if you have nidus cell area of cancer, then that radioactive glucose gets concentrated and it shows on an x-ray in the cancer conglomerate or mother cell because it's high in glucose, and that's what the cancer cells needs to eat. So you want to reduce glucose. Certainly a ketogenic diet or a very low carbohydrate diet, certainly free of sugars, will benefit a person that has cancer.
Interesting. And I understand some cancers are more affected or reactive. There's low glucose ketogenic diet than others, for instance.
I am sure, and I don't have much knowledge about that, but I'm sure that they do. And then the other factor is not just the glucose, but intermittent fasting or 24-hour, 48-hour fasting helps to support and actually regrow some of the mitochondria. So you're supporting the mitochondria as well as killing the cancer cells by doing intermittent fasting or multi-day fasting along with sporadic keto. You don't have to do keto forever, but you can certainly want to do low carb, like low carb paleo.
So that fasting, that's something that we use a lot in the MS community about autophagy. for you.
Right. It improves autophagy because it's improving the mitochondria that literally tells the cell to die, which is autophagy.
So Dr. Wahls has told me that once a month she does a 7-day fast.
Haven't done a 7-day fast personally, but I have done a 48-hour fast, and it's interesting. And I wouldn't say it's 100% fast because I use maybe like coconut oil and coffee,
Right.
which is non-carbohydrate. But after the first 12 hours to 18 hours, it gets much, much easier.
Yeah.
The fast is much easier.
I found that. I've done a 3-day fast, water only. I haven't attempted a 7-day. That would be hard for me.
Yeah, I think that's hard. And I don't know that it's necessary to do that. I think it's very necessary to be so cognizant of the foods that we're eating and make sure that we're getting the foods that we need and removing the foods that we don't need and doing at least an intermittent fast.
I think somebody like you, you don't have a lot of weight to spare, and I think 7-day fast might not be indicated for somebody like you or me.
Well, at this point, I've been on a paleo-like type diet for the last 5.5 years. So in the beginning, I weighed 187 pounds. I weigh 154 pounds or so right now. So, excuse me. So I lost quite a number of pounds, not from the cancer. I just lost it by eating healthy. When you eat healthy, your hormones start to balance and the excess weight goes off.
That's a side effect.
Exactly.
Side effect, right? Okay. Do you mind if we switch gears and tap?
Absolutely. No problem.
One of your other specialties. Well, I wanted to bring on and to speak about what you spoke about because I find that so interesting, and we could spend hours. I'd love to talk about your supplements and all. But I know that the folks are very, very interested about the dental and the different products we put out and how we could continue to obtain the most ideal dental health, because that's going to be part and parcel to our biome, et cetera, et cetera. So I learned, Dr. Wahls asked me to lecture, and I learned from reading your book and from others that I was just blown away by all the different knowledge and science that's out there that I was unexposed to in school. For example, the different chemicals in toothpaste, and baking soda is not as abrasive as I thought, and how a mouthwash can totally affect our biome and destroy, create a dysbiosis in our mouth. Can you speak to, let's say, the biome in our mouth a little bit?
Absolutely. So, one of the pet peeves I have is that some dentists that consider themselves biological want to kill all the bacteria in the mouth because they think that it's the nidus of all the infection in the body. What they're saying is partially true, mostly false. And that is that there is a healthy microbiome in the mouth. Dental plaque is a healthy biofilm. It's supposed to be there. It has always been there. If we look at skeletal remains of our primal ancestors from 10 to 20,000 years ago, you'll see very little dental decay, very little bone damage in the jaw skeleton, and lots of calcified dental plaque. So if dental plaque was all infectious, they'd have lots of dental decay and no bone around the roots of their teeth. The problem is that the oral microbiome is directly related to the health of the gut microbiome. So if you have a healthy environment, eating healthy, no chemical damage, and you have a healthy gut, you're going to have a healthy mouth. You don't have to make it happen. There are no animals in the wild that have tooth decay or gum disease on a regular basis. But if you have a cat or a dog that's domesticated, they have terrible breath, they have damaged periodontium, and they have tooth decay. And all you have to do is look at all these wonderful food products that the veterinary societies are promoting for dogs and cats and look at the first 3 or 4 ingredients. They're all grains, processed grains. Cats are obligate carnivores. They can't eat or digest grains, yet the first 3 or 4 ingredients are grains. So what's happening is they're eating these foods, they're getting dysbiosis in the gut, it's affecting their gum tissue. Cattle that are raised on grains, conventional cattle, get sick. They need antibiotics, they need hormones, they need to get fattened up, and they need the antibiotics so that they don't die yet. And then all this junk is in their meat and in their fat. That's why most red meat is unhealthy. But if you eat grass-fed and grass-finished beef, their health is in their meat and their fat. They have more omega-6 fatty acids than more omega-3 fatty acids and less omega-6 fatty acids in their fats. They are healthier because they're digesting the foods that their guts were designed to digest. So get back to the mouth. In humans, we're eating the foods that support a dysbiotic gut, create damage to the minerals in the mouth, feed the potentially pathogenic bacteria in the mouth, and then we have gum disease and tooth decay. So we need to start with the gut. But once you have a gut dysbiosis and a mouth dysbiosis, then you have to treat both independently because you have 2 now unique nituses of infection. Because once the mouth infection gets hold, even if you have a healthy gut, it's not going to take care of the mouth infection totally, especially if it's deep under the gum, like active periodontal disease.
Can you go back a little bit because you made a statement that's rather profound to me. You said that the cats cannot digest the grains.
Correct.
How does that translate to humans?
Well, they have totally different digestive systems. So their system is designed, they are obligate carnivores. We are omnivores. We're not herbivores. We're not meant to be vegetarians and vegans. We are not carnivores. We're not meant to eat only meat. We can eat vegetables, fruits, nuts, and seeds, and a variety of pastured and wild-caught animal meats. The grains are just a recent product of modern farming. The grains in ancestral times were totally different than the grains today, and they didn't eat grains 5 times a day like we're eating them. The grains, if you look at the ingredients in processed foods, almost every processed food has some form of a grain or wheat or gluten product in it. They also have a lot of chemicals and a lot of other junk. So when you get exposed on a continuous basis, you're insulting the gut microbiome and the intestinal barrier lining all the time. The intestinal membrane replaces itself every 2, 3, 4 days. But if you're insulting it constantly, the damage becomes continuous. And we get chronic inflammation that starts the process of chronic disease throughout the body.
So we also have toxins in our grains, and we have aren't there some non-digestible anti-nutrients? Let's say, for example, brown rice or
Right. So the coating in brown rice is part of the problem. There are lectins in it that are damaging to the gut lining. Unfortunately, a lot of rice is contaminated with arsenic. You don't know that. It's not on the ingredient list, but there is a lot of arsenic in some rice products. And there are lots of carbohydrates and very, very few nutrients. So they are not nutrient dense. They have very little nutrients per calorie of food.
Can you repeat that?
They are not nutrient dense. They have many more carbohydrates and very little nutrients. So you want to eat nutrient dense foods like liver, probably the most nutritious food on the planet.
The question
a lot of nutrients per calorie of food.
Yeah, I have a weightlifting friend that swears that liver is the most nutrient dense food possible. I
would agree. There are some societies in Africa that go hunting. I can't remember the ones that are specific, but they go hunting, they get their kill, they open up the cattle or whatever they're hunting, and they eat the liver raw. I mean, still hot because of the body heat.
And I also heard that some of those tribes will eat all the organs, like the liver in it, and
throw away the meat
and give it to the dogs.
Right. So you don't need that muscle meat so much as the organ meats. That's where the nutrients are.
I tell people that, they think I'm crazy. I'm like, I don't know. They eat the fat and they eat the organ meats.
Yeah, and that's healthy saturated fat. Saturated fat is a healthy fat. Most of our brain is made up of saturated fat. We need saturated fat. The idea that we don't need saturated fat is a misnomer. The saturated fat that we don't need are the saturated fats that are damaged and corrupted by the animals that are eating unnatural food products like grains, like cattle.
So we get into the area of bad omega-6s versus a grass-fed, which you actually get like linoleic or actually good omega-6s.
Yeah, I mean, omega-6s are not necessarily bad. It's just the ratio is bad. You have to have a ratio maybe of 1-to-1, and in our Western society, it may be up to 30-to-1. 30 being the omega-6s and 1 being the omega-3s. Should be 1-to-1 ideally. We're close to that.
Wow, that's. I mean, we could just chew on that for hours, because what you described is contrary to the American Heart Association. It's contrary.
I know. I know.
This is stuff.
I know, and that's part of the sad part, because I would look at the American Cancer Society, the American Diabetic Association, the American Heart Association as being the pillars of knowledge for health. Yet some of their stuff is corrupted. Some of the studies that they report are kind of cherry-picked, and it's just not it's just not healthy for the average individual, because you expect their word to be the gospel, and it's not.
And we assume it to be, absolutely. So, all right, so we talked about that. So let's really get into the dental. Let's just talk about.
Okay.
Let's start at the big thing that people ask me is toothpaste. What do we do?
Right.
What's wrong with it? What should we do? Etc. Can you speak to that a little bit?
Absolutely. First of all,
in the oral hygiene in general, maybe that'd be
okay. First of all, it's good to clean your mouth. I'm not saying you want to have gobs and gobs of dental plaque in your mouth. There are a variety of reasons that you don't want to do that. So you want to clean it effectively and efficiently. But you don't want to destroy the natural biofilm. So you need to have the healthy gut. Lay that aside, but you need to eat healthy, and you have to have a healthy gut to have a healthy microbiome.
Explain down. So healthy gut. So we swallow trillions of bacteria a day.
Correct.
And it contributes to a healthy gut. So
well, no, because the trillions of bacteria that we swallow a day are destroyed in the stomach acid. So that's not going to be a significant factor if you have a healthy body. Okay. So let's say you want to clean your mouth. Let's ignore the gut right now. You just want to clean your mouth. Number one, you don't need toothpaste. There's no reason for toothpaste. Toothpaste is a man-made contraption. If you want to clean your teeth and the excess overgrown dental plaque, take a toothbrush and brush correctly. Use dental floss and maybe just floss between the contacts of the teeth, not under the gum, because you'll cut the gum and damage the gum. And then use these little picks between the teeth called TP makes one, gum makes another one. They're little silicone type cleaning devices, like a baby bottle brush, but very, very tiny, that cleans in between the teeth right at the gum line. So you can mechanically remove the excess dental plaque by brushing gently into the gum surface with a toothbrush, a soft nylon toothbrush, and cleaning between the teeth. Excuse me?
With some warm water, or
you can use warm water. I would isolate the water to be fluoride free if you can. Filtered water. If it's not that big of a deal. But just regular water and a toothbrush and clean your teeth. If you want to use something to act as a toothpaste, I would dip your toothpaste, maybe even these little cleaning devices between the teeth, in a little bit of coconut oil, then a little bit of baking soda, and then clean with that. So the coconut oil is slightly antibacterial, antifungal, antiviral, but it's in very isolated areas. And it is a sticky substance that holds the baking soda. Not baking powder, but baking soda. Okay. So baking soda actually does a couple things. It is slightly abrasive, the least abrasive material in any commercially made toothpaste. So it will be cleansing as well as slight whitening. But even more importantly, it helps the pH, the acid level, to become more neutral in the mouth. Because if you have an acid level that is 0.5 or more acid than that, as the number goes down, like 5.0, 4.0, it's getting more and more acid as the number goes down, the acid can damage the mineral content of the teeth, creating tooth decay, and feeds the bad bacteria.
So in dental school, and my dental school was about 20 years ago, we were taught that baking soda is the most abrasive thing you can ever use. And I believe it's just last year the American Dental Association, ADA, just came out with a report saying it's the least abrasive. Correct. It is the least abrasive material that is in toothpastes. Now, if you made a very, very thick paste of it and scrubbed hard at the gum line, you will cause irritation. And that's not how you do it. But of all the materials that can be used to clean the mouth, if you're trying to use something, it is the least abrasive element that is biologically available in the mouth. I have two questions then. Okay, so oil pulling is very popular. Yeah. And I'm on the understanding that oil pulling is highly antimicrobial because you're keeping that in your mouth for a very long time. Yeah. Or for more than what you're describing. So right. Speak to that a little bit. Yes. There will be a lot of people listening to this and will totally disagree with me, but oil pulling for the period of time that is recommended, like 15 to 20 minutes, is extremely unhealthy for the mouth on a daily basis. It's just like any antimicrobial mouthwash. And I know that for a fact because if you were to do some studies and did an oral microbiome swab of your mouth, identifying the bacteria in your mouth, and then did oil pulling for 20 minutes or so a day for 30 or 40 or 60 days, and you did the oral microbiome test again, you will find a tremendous decrease in the bacterial population in the mouth. Not just bad stuff, good stuff. Oil pulling is indiscriminate. It kills and absorbs a lot of bacteria, good and bad. Now, if you had a problem, if you had sore gums, if you had other pathology in your mouth, and you needed to get maybe the bad guys, the bad microbes under control, use oil pulling aggressively for a week to 2 weeks. Use an antimicrobial mouthwash aggressively for a week to 2 weeks. And then stop it and make sure your diet is supportive to get your mouth's normal microbiome back into a healthy state or a state of homeostasis. But if you use any antimicrobial mouthwash on a daily basis, you kill many, many, many healthy bacteria. And here's a great example. There are a number of anaerobic bacteria on the top of your tongue. If you're eating sulfur-type foods, that anaerobic bacteria creates a breakdown product, creates odors that are very offensive. So a lot of people that have bad breath that's coming from their mouth want to use a very strong or any type of mouthwash to kill these bacteria and neutralize these odors. Well, they'll do that. But here's what happens. The anaerobic bacteria in the top of the tongue are there for a biological reason. If they're not overgrown and dysbiotic or unhealthy, the anaerobic bacteria starts to break down nitrates from green vegetables, for example, that you eat. They get into your bloodstream, they get absorbed by the salivary glands, and they pour out from the saliva a very biologically active nitrate. That nitrate is acted upon by the anaerobic bacteria to become another chemical called nitrite.
When you swallow the nitrite, you don't know that it's happening. It's just happening biologically. But when you swallow it, the nitrite eventually can break down into nitric oxide, which is extremely healthy for cardiovascular prevention or support, as well as decreasing blood pressure. So if you eat or use an antimicrobial mouthwash every day, killing all these healthy anaerobic bacteria, these are bacteria that don't live in an oxygen environment, and you kill them off, you will potentially decrease your body's supply of nitric oxide by as much as 25% and increase your blood pressure.
And even the report shows what 70 to 80%. If you rinse your mouth out once a day with, let's say, Listerine, you have 70 to 80% higher risk of diabetes type 2. What I think I read recently.
And there are the reasons for that, because it's damaging the gut microbiome in addition, and then all of the other things start to take hold and create other dysbiotic situations.
Okay, so
I don't recommend Listerine on a daily basis.
You do not. Okay. So the next thing people will say, well, let's add a lot of oregano oil, or let's add a lot of these tea tree oil, or these other antibacterial natural substances.
Right. They may be natural, but they are antimicrobial. And oregano oil, olive leaf oil, tea tree oil are extremely antimicrobial, meaning that they're going to be as strong as chlorhexidine in your mouth. So you do not want to use these essential oils on a daily basis in your mouth. Now, there are some essential oils that are much more mild, like peppermint. Now that you could do damage if you swish with peppermint for a long time, several times a day. But peppermint is not as strong as some of the other essential oils there. What is the purpose of using these? Is it for taste? If you want something that's tasty, take some mint leaves, make mint tea and drink it, or chew on some mint leaves, or chew on some parsley. It'll kind of neutralize some of the odors that are in your mouth.
Well, people feel that by the mint, how many have lost everlasting fresh breath? But you, as a gum specialist, you know that that's transient.
You can correct, and you're only affecting the odor, but not what's causing the bad breath. If you're eating foods that have a lot of sulfur, you're going to have a bad odor because of the way these sulfur products are broken down. It's kind of natural, so you might need to offset it with some mint or some peppermint or something that you can eat in a natural state. Leaves, not necessarily candies that are made of peppermint. Certainly, if you're cleaning your mouth properly, you're not going to have the odor of gum disease if you have taken care of that. So there are different things that you can do to help your mouth be more healthy as far as odor is concerned. If you have excess bacteria on the top of your tongue, you can take a spoon, invert it, put it all the way back on your tongue as far back as you can without gagging, and scrape it forward several times in different positions on the tongue, and you'll scrape off this little yellowish film, and that's the excess bacteria. Do it in the morning and do it in the evening. If you did that, you took that liquid, that fluid, and put it on your hand and let it dry, and then smelled it, that's what your bad breath smells like.
So then, if I can restate, kind of summarize what you've said, that you would prefer more of a mechanical cleaning of the plaque. Correct. Allowing your natural body through nutrition, things like liver, K2, et cetera, and that's going to be healthier. Correct. What I describe as slash and burn type of philosophy, where we go in and destroy everything, and we kind of hope the good things are going to grow back, but we're actually creating a dysbiosis, or it's really allowing maybe the bad bacteria to take hold with the good bacteria. Or maybe there's no good or bad, maybe we're offsetting.
Well, Carolyn Krishnan, who is the Chief Medical Officer of Microbiome Labs, will tell you, and it's rather fascinating, that there's hardly any real bad bacteria. It's just that bacteria can become pathogenic when they become dysbiotic, when they become out of balance. So in the dental plaque, for example, there may be up to 700 different species. Any individual may have 200 to 300 different species in the dental plaque. If you were to isolate any or all of those specific bacteria, some would be much more pathogenic than others. But in their balanced state in the dental plaque, they actually offset one another. They actually support a healthier environment, and they provide a barrier for other extraneous pathologic bacteria that come in the mouth.
So actually become healthy because they're going to act like your skin or like another type of...
Correct. It's a protective barrier. It is a protective biofilm.
Okay. This is another hot topic, and I love your opinion on this.
Sure.
Everybody says root canals are bad. If you have a root canal, you have to have it pulled. What's your opinion?
Okay, so most root canals can be bad, and when they do become bad, they can become life-threatening. Certainly, they can become a source of systemic infection. So you have to understand that if the root canal is done, it is done because theoretically there is a necrotic tooth, a dead nerve in the tooth that's putting out unhealthy byproducts that pour into the bone structure surrounding the teeth. Unfortunately, the root canal is not just one little opening or a hole that is at the tip of the root that goes into the bone. There are little what's called accessory canals where there are microscopic pathways for bacteria in and from the canal to get into the bone. If the root canal is done extremely well, maybe even using ozone to kill as much bacteria as it can, and it's filled in a very biological way, and there's no other problems with the structure of the root or cracks in the root or accessory canals, if they can do that, that root canal may be successful and you can live with it for a lifetime and never have a problem. But unfortunately, a lot of root canals are not done well, or there are other mitigating factors that cannot be corrected because they aren't even understood by the endodontist. Right. And then they start to create a problem. Not necessarily pain. They start to create damage to the bone and create a necrotic situation in the bone, which is profuse with all kinds of capillaries and blood vessels that can get into the bloodstream and then disseminate to other organ systems. So that's why you can find a tooth that is a root canal tooth where certain bacteria are part of this damaged root that get into the cardiovascular system, and they see it in atherosclerosis, and they see these bacteria from a root canal, poorly done root canal or infected tooth root. And that's because it has gotten from the tooth into the bone, into the circulating system, into an organ system. So for the most part, root canals have a tremendous potential to be a problem in the future. And I would be very, very cautious about having a root canal, especially if it's a complicated root canal with multiple roots and other issues that are not easily discernible. There are certain x-rays that can help to identify if there is damage from the root canal, but it's a sophisticated x-ray. It's not a general dental x-ray. It's called a cone beam CT scan, where it's a three-dimensional x-ray where who reads the x-ray can look at it in 3 dimensions, like 360 degrees, and see if there is any breakdown or lytic lesion that is starting to develop around the root of the tooth. But that's already there. Once that happens, you need to get that root canal out, that tooth out, and replace it properly. Now there's another problem. How do you replace it? Because titanium implants or titanium alloy implants, which are 90 to 95% of the implants that are done today, have an inherent problem. Titanium ions can get into the circulation and into the bone structure and create an immune response that's inflammatory. So that is a problem. Certain people that have had titanium implants in their shoulders or whatever, and they get failure and tremendous breakdown in bone, it's non-infectious. It is a breakdown in bone because of the inflammatory reaction from the titanium ions. So you have to be very careful in what you replace that space with. Now, there are implants that are made from zirconia, which is a dioxide of zirconium metal, which is similar to titanium, but not exactly. And zirconia has been much more gentle to the immune system than titanium. But there may still be a problem, but certainly not as much as titanium.
So aren't the zirconia, aren't they sintered aluminum oxide? Is another form of metal.
It's not aluminum oxide. It's zirconium oxide. It's a metal called zirconium. Zirconium and titanium are very close in the periodic chart of metals, but they have different properties. And the zirconium is combined with an oxide and some other things that create a dioxide type of product that's more white in color. It's sometimes called non-metallic, but it is. It is a zirconium.
Not zirconium.
It's not. Well, you can use any word that you want. It's a ceramic, but it is a metal base. People that say there's no metal in it, that's not correct. There is a metal structure to the oxide.
Is there enough research out to show that is more favorable than?
Yes, there is great research that shows that zirconia is better and more biocompatible than titanium or titanium alloys. Yes.
Excellent. Okay, there was a question that came up from Rosa about, I believe that you are favorable on a water pick as adjunct.
No.
You're not.
No. So let me tell you why.
Please.
So the water pick industry will not like me either. Yes, you can use the water pick if you use it at the 2 or 3 setting. Generally, water pick goes up to 10, maybe a 2 or 3 setting, spraying it directly between the teeth, but not into the gum surface. But if you do that, you're not doing very much anyhow. So here's what happens with the water pick. Most people are aggressive. They use the water pick because they think they're going to clean into an unhealthy pocket. That's the reason why they use the water pick. So they use it at a 7, 8, 9, or 10 setting. It's extremely sharp jet of water. Okay? So here's 2 things that happen. When you angle the water pick, you have no idea what angle you're really using it, and you could theoretically shoot debris from the bacteria and products of digestion into and deeper into the pocket, so it lodges deeper into the pocket. Now, let's say the water pick is very effective and you've not done the wrong angle inadvertently, and you've literally cleaned out the pocket, which I don't think is possible. But let's say you did that. Then the tissue needs to heal, but you don't realize that. So you use the water pick every day still. So now the tissue is starting to heal, but you constantly are damaging the epithelial lining that's trying to heal. It's like picking a scab before the scab is ready to fall off. So the water pick does 2 things, in my opinion. It can potentially shoot damaging debris into and deeper into the pocket. So the pocket gets more narrow as it gets deeper. So these little floating particles of debris get packed deep into the pocket and they don't come out. So they're pathogenic now, or etiologically pathogenic. And if you cleaned it out and you continue to use a water pick, the cells that are trying to heal, you're constantly breaking the bonds that are trying to heal themselves, and you get a clefting, and you never get proper healing.
Wow, that's really.
So I don't like the water pick.
That is amazing. So you actually could be pushing bacteria into your bloodstream. I mean, you
theoretically you could do that, right? I mean, if you have active disease, it's already in your bloodstream. So if you're brushing or not brushing and it's bleeding, if you have bleeding gums, you have active periodontal disease. So it may not be severe, but you have active periodontal disease. And let me tell you another interesting statistic. There was a study that was done at some university, college university somewhere, maybe 5, 10 years ago, I guess, showed or intimated that in the U.S. adult population, 93% of U.S. adults have some form of gum disease or inflammation because of the inflammatory response that should not be there.
Wow, that's profound. That's absolutely profound. So if you have these pockets, lingering pockets, what do we do?
Well, so first of all, you have to be aware of it. So you have to have the proper diagnosis. The simplest thing to do, first of all, is understand how you have to clean your mouth. If anybody wants to send me their email, I can send you the ways to clean your mouth in a healthy way. Not a problem. It's a PDF that I send out. And you have to have a healthy diet. So let's say you have this infection that's deep under the gum, you're doing all these things, or you're starting to do all these other things correctly. What's going on under the pocket is bacteria that can actually calcify. That bacteria that's calcifying hardens on the root surface, just like barnacles form on a boat surface hull when it sits in the water. So you're getting these rough, jagged edges that are literally living bacteria, and now they're calcifying. So it's called tartar or calculus, and it has to be removed. It should be removed because it's an irritant. So the hygienist, if she knows what she's doing and the dentist knows what he's doing or she's doing, can go ahead and numb the gum tissue and do a deep cleaning, trying to remove the harder calculus or tartar deposits that are irritating under the gum. That will be one thing that can be done. The other thing that can be done, which is very effective in its more advanced stages, is to try to heal the pocket and create new bone. One of the best techniques is a laser procedure called Laser Assisted New Attachment Procedure. The acronym is LANAP, LANAP, and someone could go to lanap.com, and that's the company that literally has done the research and the educational program and creates the laser that you can find if you put in your zip code in the section. It'll find all the dentists in the area that are licensed to do that procedure. So here's what LANAP does. LANAP, because of the wavelength of the laser, it's 1040 nanometers, I believe, the wavelength, or 1060, I can't remember what it is. That actually kills the very pathogenic bacteria periodontal disease, which are many, but one that's most pathogenic is called P. gingivalis. So it actually can destroy that without destroying healthy gum or bone cells. But here's the more exciting part. This wavelength of the laser apparently stimulates precursor cells in the bone, like stem cells, and creates new bone regeneration. And it's the only laser procedure that the FDA has cleared to actually create new generation of bone, the fibers that connect the bone to the root, and the layer of the root called cementum.
That's wonderful. That's absolutely wonderful. Just quickly, I'll interject, because Bobby's one of my favorite young ladies. She talks about how often you get your teeth cleaned.
It really depends on how your mouth is or isn't healthy. You can have it cleaned every 2 months or every 5 years. I mean, there's no reason to clean a mouth that's not infected or dirty. So if you're taking care of your mouth and there's no bleeding and there's no active tooth decay and there's no other soft tissue lesions or whatever, why do it?
Yeah, and that's a profound statement you just made. That probably 98% of dentists would disagree with you.
Oh, I know. Yeah. Well, it's a moneymaker. And I don't want to take away from the dentist, because this is the way dentists can find things that you don't know that's going on in your mouth. So I certainly think you need to have the examination. I just don't think that if you still have the examination, your mouth is healthy, that you have to have what's called an adult prophylaxis or a cleaning. I don't think it's necessary. Why do that? If you have not been able to clean your mouth well, you have inflammation, you have active decay, you have bad margins on certain fillings that are catching food particles, yeah, you might need to have that addressed, maybe even fixed. But if you have a healthy mouth and there is no active decay and there is no active no active gum disease, no bleeding, there's no reason to clean your mouth.
I would love to scream
professionally
for street corners, because that is the most profound, simple thing that I've ever heard. And I just love it to death. Let's not fix what's not broken.
Exactly. Exactly, and it actually can do more damage. You can have prophylaxis done, adult cleanings done that are going to actually damage the gum where there's no damage.
Absolutely. Yeah, I went to hygienists, and that worked for me. I would get done. My mouth is full of blood, and I know my gums weren't deserving of that. Okay, let's switch a little bit here. I don't want to take a lot of your time, but I know you got to be gone.
Oh, I'm good until 2:00.
All right, because I can't get enough of this. I want to make sure I get everybody's questions. Toothpaste or mouthwash? He's already addressed that. I'll rebroadcast. You'll be able to talk to us. But let's talk about filling material, because I think that is a huge. It's a huge topic. We'll go back to silver and the old white fillings and the new white fillings to. Well, then we could talk about fluoride. I mean, those are my burning questions.
Sure. So, of course, there's no silver in silver fillings. It's mercury, and it looks like it's silvery looking, but it's not really silver. It's free mercury, and I will say absolutely 100%, you do not want a mercury filling in your mouth, period. Certainly you don't want it placed in your mouth. If you have a mercury filling, now you have the problem of should you remove it or not. Yeah. There is some question about that. I will tell you that if you have a mercury filling in your mouth, it is constantly releasing free mercury on a daily basis, 24 hours a day, 7 days a week. That's not healthy. Now, the problem is, how do you remove it? The average general conventional dentist would take a drill it out, and flush it out, and put another filling in. The problem is, if they do it that way, it will vaporize all of this free mercury in the mercury filling, and you will get a huge toxic exposure, not only in your mouth that you will swallow, it'll get under your tongue that goes into your bloodstream instantly, and some of it you will literally breathe in, so it'll go into your lung tissue and get into your circulation in that fashion. So there are certain very biological ways to do that. There is an organization called the International, I hope I get it right, the International Academy of Oral Medicine and Toxicology, IAOMT.org, where they actually teach dentists how to remove amalgams biologically in a healthy manner, and you can go onto their website, put in your zip code where they have the page for patients to look up dentists that are licensed to do that or have done the training, and you can find a dentist in your area that actually does remove amalgam restorations correctly. To replace them,
yes,
composite restorations are good. The newer composites are literally BPA free, bisphosphonate free, but unfortunately, these are still materials that may have some toxic reaction to some people. So there is a test called Clifford Biological Compatibility Test, I think it's what it's called. Clifford, I know, CLIFFORD, Biocompatibility Test. That is a blood test that your dentist could get you to a blood draw and send off a tube or so of your blood to this company, and can identify if you have sensitivities to some or all of the dental materials that could be put in your tooth. And that way the dentist could select a tooth product that you're not biologically sensitive to. So that's one thing that you could do. But definitely composites are significantly healthier than any kind of metal restoration.
Okay, so I have many multiple sclerosis patients that will call me on a daily basis, and let's say they have, let's just say 30 amalgam films in their mouth.
Yeah.
And so I'm going to say mine. Some people recommend if you're going to remove those amalgams, even if you do it biologically, you should do it maybe 2, 3 at a time.
Well, I that makes sense because there is an exposure no matter what is happening, no matter how careful you are. So I think that to do maybe a quadrant at a time rather than all of them at
Okay.
one time. So if your mouth is divided into 4 sections, everything that's on the upper right, do it one time. Everything that's on the upper left, do it another time. Lower right on one occasion and lower left on another occasion.
Okay, I'm going to pick your brain more. Can you speak about fluoride? Because now this is something I would write on a daily basis. My children, I would give fluoride tablets because we're on pill on a well.
Mm-hmm.
Now I consider fluoride to be a neurotoxin.
So fluoride is a neurotoxin. It displaces iodine in thyroid glands. Obviously, it's a very, very bad thing. There are some studies that show that people that have been on fluoride have a lower IQ. I mean, these are documented, peer-reviewed research that you can find on PubMed. It's not something that I just made up in my mind. Right. So there are problems with fluoride. So the first question I would have is, why are you using the fluoride? If you say, my dentist told me to, that's not a good answer. So why are you using the fluoride? So the fluoride will kill some bacteria. Yeah, it does that. And it acts as a barrier. Yeah, it does that somewhat in of itself. So why are you using a barrier on the tooth? Are you trying to prevent tooth decay? Well, all you have to do is understand why you have tooth decay. And there is two major reasons you have tooth decay. Number one, you're eating free sugars. Number two, you're drinking acid drinks. That's it. Now, there was a great paper that was published in the Journal of Dental Research, which is a very prestigious journal. I would guess maybe 4 years ago. I can't remember the guy's name that did it, but he did a project that reviewed all the literature on why teeth decay. You can look at the World Health Organization, and it has stated that free sugars are the biggest reason and problem for tooth decay, as well as other diseases, but specifically tooth decay. So sugars feed the bacteria that become pathogenic, that break down the root of the tooth because they produce acid. The other thing is, if you drink soda, and I mean any soda, kombucha, which is healthy, well, maybe not so. Kombucha. Sport drinks, very unhealthy, lots of sugars and lots of acid. If they're artificially sweetened, the artificial sweeteners damage the gut. Even though they taste sweet and they're not caloric, they damage the gut. Plus, they still have the acid. And the acid is so highly acidic that it dissolves the root surfaces of the teeth. Some people drink soda, they sip soda all day, like I'm sipping water in this little container. So when you bathe your mouth in acid, you are promoting tooth decay. And that's why children have decay. They're not eating candy, but they're drinking soda all day.
Okay, so for example, my wife grew up on Pepsi. That was her main drink.
Yeah, well, your wife has to get rid of that.
Yeah, well, she doesn't do it anymore. But what she's done is switched over to carbonated water.
Carbonated water is okay.
It's not acidic.
It's not acidic unless it has other acids that are added to it. But just carbonated water, like, for example, mineral waters, Perrier, not a problem.
Understood. Okay. Wonderful, wonderful, wonderful. Okay, can we touch a little bit on nutrition? Like,
sure.
Like what we could do. All right, let's say, for example, I have 5 children. So the K2s, what am I doing nutritionally to try to prevent gum disease?
Okay. So you definitely want to remove the free sugars. And free sugars are any sugars that are added to natural food. So blueberries are not free sugar. But if you have a bowl of blueberries with some powdered sugar on top of it, that's a lot of junk. Okay? So the free sugars are added processed sugars that are unnatural to the food itself. Of course, if you ate blueberries all day or bananas all day and they stuck in your teeth, there are concentrations of sugar that could be unhealthy. But in a normal situation where there's 1 or 2 servings, regular fruit's not a problem, but if you add sugar to that food, it's a problem. And that goes for anything, in a drink or in cooking or whatever. All free sugars create an environment for pathologic bacteria to grow, to create acids that create tooth decay. The other thing is grains. Grains have a chemical called phytate. Phytate literally binds to minerals, the minerals that you are in your saliva to support a strong, healthy tooth from the external surface. And that will actually, when you're eating the phytate in the bread or whatever, it's going to absorb any minerals in that area. It's not going to absorb minerals that are not part of your diet or in your saliva at that point, but at that moment, it can bind to the minerals and get excreted. That's not good. So you want to reduce carbohydrate like grains and certainly reduce free sugars. And this is a problem because in our modern Western society, we eat grains 5 times a day and we eat sugars 5 times a day. So it is a problem. But these are things that you can remove and substitute. I actually have a program, I think I sent it to you, called the a dental nutritional counseling program, where you can actually have patients or an individual, you can do it in your home, have an individual fill out a 3-day food journal, and I teach you how to look at the foods like sodas, grains, and sugars that are a problem, that are being eaten frequently, and I have suggested substitutes that will substitute for the grains and substitute for the sugars and substitute for the sodas, so that you're not devoid of these delicious foods, theoretically. I'm giving you something as a substitute that is healthy but not damaging. So those are the ways to go about eating healthy.
On that note, Dr. Wahls talks about gluten in the grains, and so people then immediately say, well, I'm going to eat gluten-free, which turns out to be what? High sugar, high salt, So gluten-free has a lot of grain products in it that are not gluten grains, but they are non-gluten grains, and that can be a problem. These grains also can still have phytates that are not, and they don't have the gluten. In addition to that, there are chemicals in these grain products like glyphosate residue that is very damaging to the gut lining, not necessarily to the tooth surface, but is in the gut lining as well as the gut bacteria. So I would kind of avoid all the grains. That's hard to do, but it can be done. Yeah, I've done it, and it was very difficult at first, but it certainly can be done.
Yeah.
So then the next topic, and it may be the last one because I know we're running short on time, remineralization or reversing decay.
Yeah.
Is it possible, and how would we do it?
So the minerals that you need to reverse decay come from your saliva, and they come from the foods that you eat. So you have to have foods that are organic, high in nutrition and nutrients, that get digested in the gut, absorbed into the bloodstream, reabsorbed into the saliva, and get flowing 24 hours a day, 7 days a week. So that's where the minerals are really coming from. Now, there are certain foods that you need to support for, like calcium, support calcium, which would be vitamin K2. So where do you get vitamin K2? K2 is very high in grass-fed butter and raw milk products or raw cheese. These are great products or sources for vitamin K2. It's not K1, it's K2, and that helps to help calcium get deposited into hard structures and not into soft tissue. People that are on calcium supplements that don't have any K2 in their diet, in naturally or even supplement form, can develop high levels of atherosclerosis, which is where calcium starts to deposit into the arteries in the cardiovascular system because it's not directed properly. K2 is a natural process where it pulls calcium from soft tissue and puts it where it needs to be in hard structure.
Is it also true that K2 also could stimulate stem cells within the dentin to create a stronger dentin or a reparative dentin?
Yeah, and K2 actually has been identified to restore damaged mitochondria. Very interesting in that respect. I'm doing a double-blind study that is using spore-based probiotics as well as a high dose of vitamin K2, just approved by the Institutional Review Board. We're I'm working with 3 different dental practices. We're going to have about 50 to 60 participants to study that.
So on that topic, which is not a dental topic, would that K2 also help with young ladies in osteoporosis?
Absolutely, absolutely, and of course, weight bearing exercise is good for osteoporosis. Certainly, a healthy diet is good. No soda, because the phosphoric acids are helping to demineralize the bone. So you don't want any sodas. You don't want any grain products. You want to eat sardines with bone in and skin on. You don't want to eat anything that's boneless, skinless. You want the bones. You want the skin. You want the healthy foods.
Very interesting. Very, very, very. Well, I gotta say, might have been the most informative interview I've ever done. You've dumped out an incredible amount of information, so much so that I may even go back and review it, because a lot of the things you said are contrary to what most dentists would.
Yeah, I know, and that's a problem. It's a problem because the organized dentistry and organized medicine do tend to push away some of these thoughts and ideas. Like I said, the dental schools are still teaching students how to put mercury fillings in teeth, which I think is a disservice, if not unethical and very damaging and dangerous.
So about a year and a half ago, Dr. Wahls asked me to speak at her seminar, which I was very flattered, but she didn't give me any direction. And then I began to do this research, and I kept reading, and I kept falling in these rabbit holes. And it was always like, wow, fluoride does this. I mean, everything was contrary to what I learned.
I know.
So I had to submit my lecture to Dr. Wahls before I lectured, and she said, I thought I was going to have to direct you where to look, and you found the information. And she said, good job. And I was like, wow, that was. But it took me about 3 months to gather all this information for me to realize, well, for people like you, from different. There's a gentleman out in Australia. His name is slipping, that brought attention to this, and so I went directly to the research, and everything you've said is clear.
And you know what's interesting? You said that you found the research. It's there. It's not like it's hidden under layers and layers and layers. All you have to do is click onto PubMed, put the words in that you want to search for, and you're going to get all these articles. And these are intellectual, peer-reviewed articles that the science is there. The profession is ignoring it. The school, the educational system in medicine and dentistry in Western societies are ignoring it. And I'm not really sure why. I think that today patients are going to drive the professionals to get more educated, or they're going to lose good quality patients because they're going to seek out professionals that are more in tune with the biological aspects of medicine.
To that note, well, there's 2 things I'd like to talk, and we got maybe 2 minutes, maybe even less than that. But so I went in the toothpaste aisle in Sprouts, which is considered like a health food sort of kind of store, and I was then able to find 1 tube of toothpaste that I approved of that didn't have silica, that didn't have triclosan, that didn't have fluoride, that didn't have whatever sodium lauryl sulfate. They just don't exist.
Even the ones that say that they are natural, the word natural is not a legal term, so they can almost say anything.
Oh, this is one thing. A lot of the young people now are brushing with charcoal to whiten their teeth.
Yeah, so here's the problem with charcoal and bentonite clay. First of all, there is a paper that suggests that there is no difference between charcoal or non-charcoal toothpaste. That was a double-blind study. But let me just tell you that activated charcoal and bentonite clay are extremely good binders, meaning that if you have toxic elements in your system, your gut or whatever, you need to get those toxic elements out so that they're excreted properly. Binders are the effective way to do that, but they are binders, and they bind to a lot of stuff, and they tend to bond to minerals, and they can bond to minerals in your saliva, where you think you're getting a whiter tooth, but you're doing unfortunately doing things that are unhealthy for the surface of the tooth as well as the bacteria that may be in the area. There was a study that was done a long time ago. I'm thinking 15 plus years ago. It had nothing to do with dentistry, but they used activated charcoal in orange juice, and they were obviously trying to determine the nutrients in the orange juice, and they found that as they increased the levels of activated charcoal, the nutrient level of orange juice decreased because the activated charcoal was binding to the nutrients in the orange juice. Now, orange juice is not necessarily a healthy drink because there's a lot of sugar, but the nutrients that are there, they actually got bound to the activated charcoal. It's a gimmicky thing. Here's the best way to whiten your teeth. Go ahead and take a thick paste of baking soda. So it could be very abrasive, but only put it on the enamel of the tooth and just scrub it on the enamel surface, the white surface of the tooth. You will lighten the tooth slightly. There's another thing that you can use, and that is strawberries. You can take crushed strawberries, which have malic acid in it, and combine it with some baking soda and a little bit of fluoride-free water, and make a paste of it and brush with that. You will get some whitening. The whitening that's done in a dental office with a machine like Zoom is very effective. Here's the problem with whitening trays. People will use whitening trays to keep their teeth white, using them every day at night. So there was a study that also was done showing that the peroxide in the whitening tray is either absorbed through the gum tissue into the bloodstream or swallowed into the gut and gets into the bloodstream, creating oxidative stress that is typical of a person that has just had a heart attack. So that is actually in PubMed. You can read the research. It's there for the reading. So I'm not saying don't use peroxide, but use it discriminately, not indiscriminately. Use it for a week and then stop it, but don't do it every night forever because you want these pearly white teeth. Pearly white teeth are not natural. When you have teeth that look like chiclets, they look abnormal.
Just so you know, guys, a lot of those on TV with pearly whites, they have porcelain. They're laminates. They're not white. They're not white.
Yeah, they are all artificial.
I know you got like 1 minute to go, but would you also say that charcoal is very abrasive?
Don't know how abrasive charcoal is, so I can't tell you that. Probably because if it's whitening the tooth, the only way to whiten the tooth is either absorb the stain material or abrade it off. So the reason why the baking soda works because it is creating an abrasive surface because you made it so thick, but you're only using it occasionally and only on the enamel surface. It's not going to be much of a problem, and it's not going to wear the enamel away. That's not that abrasive.
He's talking about staining on teeth is either intrinsic or extrinsic. So
right.
Abrasive materials are going to take away extrinsic. So like
right.
You have a dirty plate and you use a SOS pad and you scrub it, you're going to get the dirt off. Intrinsic staining is something that would be done like with a Zoom or trays in which use hydrogen peroxide, which will work slightly into the enamel, but the downside is you're absorbing it some way through your gut, through your gums, as you just said.
Yeah, you have to be careful. You're not going to do that on a regular basis. The biggest problem is these take-home bleaching trays where people put a bleach in it or peroxide, a high concentration of peroxide that are whitening the teeth. They're going to be whitened, right. But the peroxide that leaks through the gum tissue or into the gut can be very damaging long-term, systemically, and no one knows how damaging it is because it's never been studied.
You know what, Doctor? I'm going to let you go because I know, and these are a lot of people are asking, exactly what vitamins. Maybe we can do that in another podcast. But
natural food is better than vitamins.
Thank you, Vincent A. Price, right? Go Factors.
Yeah, Weston A. Price is good stuff.
Vincent, yeah, that's a different person. Weston.
Yeah.
You know what? I just can't thank you.
Vincent Price was the guy that was a scary guy a long time ago.
Michael Jackson songs and everything else.
Yeah, the haunted house, that kind of stuff. That's my day and your day, maybe, but most people listening to this podcast have no idea what we're talking about.
Yeah, they have no idea. I talk a bit to Lou Ferrigno now, just by chance. My daughter the other day, if she knew who Incredible Hulk was, she looked at me like I had 3 heads, and like, yeah, I'm feeling very dated, and I'm going to be 50 this year. But you know what? I mean, you just poured out so much information. There could be a whole book in itself on dentistry and the information. I just hope that people take this. Dr. Danenberg is not making this stuff up. This is all from primary research, well, peer-reviewed research. It is not nonsense. Your dentist isn't going to agree with this, most likely. And one thing I want to leave you with. I know we got no more time, but not all biologic dentists, by the way, are created equal. No.
And this is sad because first of all, there's no approved profession specialty called biological dentist. So anybody that's a dentist can say, I'm a biological dentist.
Thank you.
And in my opinion, I know some really good biological dentists, but a lot of biological dentists believe that the problem is the bacteria in the mouth, so kill all the bacteria. So they're the ones, they whip out a microscope, which is kind of an interesting joke. It's a good teaching tool, but you can't, most of the bacteria are not observable. They can't be cultured. To think that you can see all the pathogenic bacteria in a swab of the mouth is a joke, because most of the bacteria that are potentially pathogenic in a healthy mouth are not. So if you want to show a person that they have bacteria in their mouth, that's much better if you see the bacteria than if you take a swab of their saliva and there's no bacteria. Then you've killed all these good bacteria. That's much more unhealthy than healthy.
Wow.
So I would not jump to any procedure that wants to kill all my good bacteria.
For example, like ozone therapy covering the whole mouth.
Well, and then ozone is great therapeutically. Use it therapeutically. You're not going to use it every day. Now, you can get ozonated water to rinse your mouth, or ozonated olive oil that you can rinse your mouth out every day with, and that is a no-no because you're killing everything all the time.
It's a paradigm shift in thinking, even for me. You know what, Doc? I know you're going to run. I just can't thank you enough. I mean, this was profoundly, and at least the best interview that we've ever done. And
well, you're very kind. Thank you.
I'm really not trying to be kind, because these are questions that I get every day, and and I answer these questions similar.
Well, I do write quite a bit, and I have lots and lots of blogs. Maybe, I don't know, 300 plus blogs on my website. So anybody can go to my website, which is drdanenberg.com. Just go to the blog section, and there's a little question, a search tab. You can write in a question or a word that you want to search for, and any article that I wrote about that subject, you can pop up and print out and do whatever you want.
Emphasize enough, guys. He is not making any of this stuff up. I've seen the research. I mean, the questions he was answering, there's a bunch I've learned, but there's a bunch that I knew, and unfortunately, with us MSers or other chronic diseases, unfortunately, there's people looking to profit off us. So, I mean, you got to go in knowledgeable. You have to do your own research sometimes, because, for example, taking all your silver fillings out of your mouth, I'm not going to say you're going to start walking again. There's a lot of different things that I think we have to do.
But it could be a huge factor because of the neurotoxicity of the mercury. So
correct.
Only have it removed by a dentist that has taken an approved program like the one that it's called SMART, SMART, but it's through the IAOMT, the International Academy of Oral Medicine and Toxicology.org.
I wish you all the best. I wish you'd continued healing.
Oh, I'm going to try. I don't feel like I want to die yet.
Yeah, no.
But we've had a talk before. I'm ready for whatever outcome, and I know I have an incurable bone marrow cancer. I get it. I'm okay with that. I'm going to do everything I can to extend my life.
Still writing blogs. I look forward to them. If you guys haven't seen his blog, I usually try to repost his blogs. If you don't have it, if you don't subscribe to his Facebook page, you should. I'm not kidding. I consider you a great man, and I learned so much from you, and I just can't thank you enough.
Well, you're very kind. Thank you, and good luck with your journey. I know it's a rough journey. I know.
they're all rough journeys
They are.
too. So,
Thanks.
I have 5 children and a wonderful wife. So
That's everything, by the way.
yeah, it is everything. It's not so much about me anymore.
No.
It really isn't. So
Yeah.
I'm gonna actually go get some sun now, even though it's a little chilly. But I'm gonna get some vitamin D and maybe do a little meditation. And I'm just profoundly appreciative and have so much gratitude. And I know so by the comments that people are going to continue to learn. I'm going to post this on Wahls' website. I'm going to post this on our website, and then I'm also going to post this on the YouTube channel because I'm even going to go over this and listen again. And I encourage everybody to do this because what he's described, you won't hear anywhere else.
Well, if I screwed up, you let me know, okay?
Yeah,
I can misspeak. That's possible.
I suppose it is, but
I'm sure.
I haven't heard anything like that. Yeah, unless you're God at thank you, and I wish you can please keep stay in touch.
Thanks, Ryan. And we'll keep in touch. Be good.
Of course.
Take care.
Thank you. Bye. Be well.
Thanks. Bye.
He's awesome. Like